All right, let's dive into a really fascinating and honestly a kind of counterintuitive medical condition called Brown syndrome. This is one of those cases where the body's own mechanics just get in the way. And the solution? Well, it's probably not what you're thinking.
So to kick things off, I want you to try something. It's super simple. Just try to look up and then inward, toward your nose. Easy, right? For most of us, it's completely effortless. But imagine if you couldn't. For some people, that exact movement is physically blocked. And we're not talking about weak muscles here. Something is literally getting in the way.
In that condition, right there is what we call Brown syndrome. The most important thing to get your head around is that this is a mechanical problem. You can think of it like a hardware issue with the eye's physical parts, not a software bug with the nerves or the brain sending the signals. The signals are fine. It's the machinery that's jammed.
See, in a typical eye, all the muscles are supposed to work together in perfect harmony. That specific movement, looking up and in, or what doctors call elevation and adduction, is absolutely crucial for having a full, normal field of vision.
But with Brown syndrome, that exact movement is either super limited or just impossible. The eye literally just hits a wall. But here's what's so interesting. Other movements are usually totally fine. The same eye can typically look up and out with no problem at all. And that right there, that's a huge clue as to what's really going on.
So what is this mechanical failure? Well, the best way to picture it is like a stuck pulley. There's this tendon called the superior oblique, and it has to glide smoothly through a tiny little ring of cartilage called the trochlea. Think of it like a rope through a pulley. In Brown syndrome, that tendon, it just gets stuck. It can't slide through.
Okay, so let's walk through how this actually happens, step by step. First, your brain sends the right signal, no problem there. It tells the eye, hey, look up and in. So the superior oblique muscle tries to relax to let that happen, but nope. Its tendon gets snagged in that little pulley, the trochlea. It just won't slide through. And the result? The eye is physically tethered, like it's on a leash, and it's completely blocked from looking up and in.
Now, this little mechanical glitch leads to a few other telltale signs. For example, when someone with Brown's looks up, their eyes might kind of drift apart into a V shape, just because one eye can't lift up properly. But, and this is a really important point, when they're just looking straight ahead, most patients have perfectly normal straight eyes. You might not even notice anything is different.
So you can see why this is a bit of a diagnostic puzzle, right? This inability to look up, it really looks like a weak muscle. So doctors have to be careful to tell the difference between this mechanical problem and a true nerve-related weakness, what's called a palsy. They have to specifically rule out something called inferior oblique palsy, which at first glance can look almost identical.
So how do they tell them apart? Well, the key is a physical test called the forced adduction test. It's actually pretty straightforward. A doctor will gently try to move the eye for the patient. Now, in Brown syndrome, they'll actually feel that physical restriction. The eye just won't go. But in a palsy, the eye moves freely because there's no mechanical block. That simple physical test, that's the definitive clue. It tells them everything.
Okay, so now we know what it is and how it's diagnosed. But just how common is this? Well, estimates put it at around 1 in every 20,000 people. So while it's not super rare, it's definitely not something your average doctor is going to see every single day.
What's really interesting is that the vast majority of cases are congenital. That means people are born with it. And here's where we get to a really hopeful and honestly fascinating part of the story. The condition is seen way more often in young kids than in adults, so why is that? It's because in a lot of cases, it just resolves on its own as the child grows. Usually by the time they're about 10, their anatomy has changed just enough that the problem, well, it just disappears.
And that brings us right to the management plan. I mean, if a lot of these cases just fix themselves, what do you do? Well, for most kids born with Brown syndrome, the most common and effective treatment is simply watch and wait. Careful observation, and a whole lot of reassuring the parents that things will likely get better on their own.
So when is a more active approach needed? When do you actually intervene? Well, surgery is really only on the table in a few very specific situations. Like if the child starts developing a really noticeable and uncomfortable head tilt to try and compensate, or if their eyes start to get misaligned even when they're looking straight ahead. Another big one is if their ability to use both eyes together starts to go downhill. And for those very rare cases that people get later in life because of inflammation, sometimes steroids can help with that.
So, what's the big takeaway here? I think it's this. For a condition that has such a clear physical-mechanical cause, you think the solution would have to be a high-tech surgical fix, right? But more often than not, the best approach is just patience. It's allowing the body's own natural growth to solve the problem. It really makes you think, doesn't it? In this era of incredible medical technology, how often is the most powerful tool we have just a little bit of time?